It's my first Spring Congress, actually. I go to the winter one, but I'm overwhelmed at just the energy and excitement at the Spring Congress too, so now I'll come back twice a year. You come to this conference and practitioners are learning incredible information. The evidence base for supplementation, for lab testing. Fullscript just wants to help that practitioner and be the clinical tool to now take all that information and easily use it on Monday morning, right? So often you come from a conference, you've had 20 different lectures and you're kind of not sure where to start. So, the ability to build templates with the supplements that you learned about, lab panels with the labs you learned about. Fullscript just wants to be the extension of that practitioner and be that clinical tool that optimizes their workflow and keeps them on the cutting edge of care. It's a really exciting year. Right before Longevity Fest in 2024, we announced the acquisition of Rupa with the intent of, again, being that full clinical tool for practitioners. Rupa had done an incredible job of education and really solving some of those workflow issues for practitioners by having all the ordering in one place. So the integrations team is constantly working on the ideal workflow of bringing the Rupa experience into Fullscript. So we've taken the best features of Rupa and really had that inspire the Fullscript lab ordering platform, but also made sure that our rule number one is do no harm. Do no harm to the practitioners, their workflow, patient information. So soon, over the course of 2025, we're going to be working with practitioners who are ready to move over, white glove service in terms of our care and making sure that that happens without any harm to their practice. And then we'll start rolling that out across the platform. So we're really excited to bring that all under one roof. And again, both companies really solve the problem of having multiple accounts. Now practitioners have both accounts. How do we now take that to the next level? And it's been in our DNA since the very beginning to optimize the workflow of the practitioner and deliver incredible care. And that's the same way we approach AI. So our medical team is working hand in hand with the AI team to make sure that we deliver a very elegant experience that's trusted, that's evidence-based, that's safe, and that's part of the workflow for the practitioner. So as we use AI in part of our lab interpretation tool, we want to make sure we've got the evidence that backs up those recommendations and that it's teed up for it to be in the practitioner's voice to deliver to their patient. And then on the side of ideal supplement planning, using all the information that the EHR has, that Fullscript has, to really help kind of get a treatment plan to seconds for that practitioner, again, with the evidence link, with the education behind that. So hopefully, some of the early days of AI and using it as a transcribing tool has sort of made it a little bit more comfortable for practitioners to see the potential for it. We want to then bring in some of these optimizations to make life easier. Our whole goal is to allow practitioners to scale themselves, right? Patients are demanding this kind of care. We don't have enough practitioners to deliver it. How can we scale each of these practitioners who are passionate about whole person care to now meet the needs that we're seeing from the patient perspective?